Kathy Richards here with this JTV and News Hurricane Irma update, and I'm now with the CEO of the Peebles Hospital.
Yes.
Mr. Chester, how has things been since hurricane hit this territory?
It has been hard on everyone. All of us here as staff, and of course on the country, and of course our prayers is with everyone. You know, we send that out to everyone. At Peebles Hospital and for the BVI-HSA, we have been part of the NEOC from day one, ensuring even before the hurricane that we had our supplies in place and that we were able to look at staff in terms of scheduling. Of course, from since last Tuesday to now, our next focus is in terms of bringing back normalcy to our operations. So in terms of relief staff to come in terms of our ongoing updating of our supplies list, supplies for medication, supplies for consumable medical supplies, and supplies for food, water, fuel, right? So we are on top of it, and I just need to note to the public, the team here at BVI-HSA, in terms of our executives, in terms of the managers, the supervisors, and all staff, it's tremendous. We have all been able to rally together as a family, as a BVI Health Services Authority community, supporting each other. Of course, at times, you know, tempers might be a bit frayed because we are all under stress. And for the staff, despite their personal losses, which has also been tremendous, my doctors, nurses, all members of staff have lost, you know, their houses, etc. We are putting that aside and ensuring that, you know, medical care is provided as required.
Okay, it's very obvious that one of the structures that withstood the test of Irma to stand up is the Peebles Hospital. Tell me, how did this infrastructure fare?
Sure, and I don't know how much of this is known, but in terms of the construction for this facility, a lot of thought would have gone in to ensure that it can withstand, you know, hurricanes, etc. We would have also, the facility would have been assessed years ago and even recently, as a few months ago, by the Pan American Health Organization, PAHO, with the support of the DDM, looking at what you call a safety index. So we rated the highest in terms of safety. And similarly, as part of that, it's for us to ensure from an infrastructure perspective that there's the ongoing review and checks in terms of maintenance. So that was maintained all the way through. And we withstood the test in terms of hurricane. So the windows are all hurricane weathered in terms of being able to resist or stand up to 200 plus, you know, gale force winds. We did have, you know, a bit of sharing and maybe a few cracks here and there, but the facility stood up. In terms of electricity, so whereas the entire nation would have been compromised, the capabilities, the redundancies that we have for generator power, that was also tested, and everything, you know, stood up. So the generator capacity that we have ensures that not just our critical medical equipment, but all areas of the infrastructure has, you know, electricity running through it. And we do have, and initially we did top everything up in terms of our fuel, so that knowing that we need to withstand at least for 10 days. And since then, every day we are topping up in terms of our fuel for where that is concerned.
Okay. Walking around the hospital for the past few days, we have seen quite a number of people with bandages, with different patches, ailments coming in. How extensive was emergencies at the hospital during this hurricane?
Sure. So the day after, we would have seen, of course, you know, an influx of persons coming in. The first 3 days, we would have been treating upwards of, say, 200 persons per day. It was a heavy strain. But again, we had scheduled staff. So in terms of, say, our clinical staff, we had a team of 21 on the medical side here. We had a team of, I forgot how many nurses, but a good contingent of nurses here. Similarly, from dietary, because remember, for us in health, it's not just the doctor by themselves or the nurse by themselves, it's a team effort. So persons from lab, from pharmacy, from imaging, we had our dietary, we had, our environmental services, everyone here on board waiting. So once the disaster, once the hurricane had passed, we had persons coming into our emergency department. So I said in terms of, the influx for the first 3 days. In the initial first 3 days, I know that we had 4 major surgeries that we performed in terms of, massive or severe lacerations. And from day 4, we then activated our Rotang clinic. Right, so that took the burden off of the emergency department, and that area by itself, once we, in terms of triaging, so based on the level of injury or the severity, persons who were at a certain category, those who treated in the emergency department, and everyone else was down at the clinic. So that separated things out. So things are also coming back to normalcy where that is concerned. There's been a steady reduction in the number of persons accessing care. So we dealt with that first wave. The second wave that we are dealing with now would be our chronic patients, so the diabetics, the hypertensives, etc., and ensuring that their medications are being topped up, because our pharmacy has been functioning, dealing with our inpatients as well as those out in the community. And again, hats off to members of staff. I can't keep on stressing to the public in terms of the tremendous support and the work that has been done by our staff, and again, all categories of staff, despite their own personal losses.
Okay. Yes. Any of your emergency cases, have you had cause to have persons air dash to other international facilities?
Mm-hmm. Yes, we did. I don't know how well this is known, but Bougainville private facility suffered heavy damages, and we took some of their patients here. One of their patients was somebody that was already earmarked to be airlifted. So in all, we have medevaced in terms of sending persons across Puerto Rico, 7 persons, and varying degrees. Some were persons that were earmarked prior to Hurricane Irma to be airlifted out, right? We had a burn victim, etc. So we have those cases that went out.
Okay, and quickly, one other thing: prescription medications for persons who with chronic conditions that you would have had to service, those in shelters, those in homes. Yes. How have you been coping with this? And also talk to me about the level of availability of the main supplies that you need for your pharmacy.
Sure. So in terms of pharmacy and pharmacy services, some of the persons that we have assisted thus far are persons who would have normally gone to other private pharmacies. So we were able to, refill some of their prescriptions since, initially those pharmacies weren't open. But I do believe BNF, and there's one other, I can't remember the name, that is open right now. In terms of supplies, as part of our preparedness for the hurricane, we had topped up or received, filled our list. So both food as well as pharmaceuticals, mindful of what may come, we had increased our stock levels, right? That was one. And since then, we have, when the UK ship arrived, we provided them with a list of our needs in terms of, since we saw, based on the lacerations, etc., we would need an increase in antibiotics, an increase in some of the chronic disease, like for diabetes and hypertension, in light of what was going on, nationally. And so I was able to basically empty their stores and just have that here in reserve. And similarly, we would have sent out our list through the NEOC to our counterparts overseas to get our routine supplies in quickly. And I'm happy to note that up to last night, we got our second or third shipment as we normally would. Yeah. Okay.
As CEO, Peebles Hospital, thank you so much for this update. And so you heard, the Peebles Hospital is heading back to normalcy. With this JTV News Hurricane Irma update, Kathy Richards.
Thank you so much.